So if your cervix isn't opened enough to have your waters broken straight away, then we use one of the other three methods. And our first line for all inductions here in bath is the cervix ripening balloon. And this is a really safe way of inducing your labour. So there's a little bit of a diagram here just to talk through how we do it. So as you can see, you've got your cervix here. So your cervix, when it's not in labour, is long and tubule, and sometimes it's a little bit open and we can get a finger through, other times it's completely shut and we can't do that. And so when your cervix, it has to be a little bit open for you to have a cup balloon. We feed the plastic bit of the tube here through your cervix, as this diagram shows, and then this is the first balloon that's deflated and the second balloon that's deflated. So one balloon is up inside your uterus and the second balloon just sits externally at the opening of the cervix in the vagina. And outside here you've got your three different taps, which right there on the cup ripening balloon. And so you've got V for vagina, that's the way we inflate the vaginal balloon. You've got S for stylet, and that's purely just to give the plastic tube the strength to fit through, because otherwise it's just too limp. So we use the stylet to insert it with, and then that comes out straight away once it's in and we're happy it's in the right place. And then you've got the uterine tap to fill the uterine balloon with. So you can see that you inflate that balloon up in the uterus and then you bring it back a little bit. That's it when it's inflated and it looks a bit like the size of a large plum. And then we inflate the vaginal balloon, and once we're happy that both balloons are in the right place, then we take our hands out and we stop the internal assessment. And the thinking is that if your cervix is like this and you've got a balloon sat on top like this, another balloon sat under, it's a weighted mechanical process way of making your cervix open. So rather than using a prostaglandin drug, which can make you have too many contractions, which obviously then will be stressful for you, but it also can be stressful for your baby, or if you've had a previous cesarean birth and you've got a scar in your uterus, we don't want to make you have too many contractions. So this is a really safe method to induce your labour, because it's just purely mechanically stretching open the cervix by the diameters of the balloon. These balloons stay in for 12 hours, but they may fall out sooner. So if your cervix stretches wider than the diameter of the balloon, then they simply just come away and fall out, and that's a real positive thing. If that doesn't happen, that's absolutely fine, because all we'll do is take it out after 12 hours and then do a gentle assessment to make sure that it's done its job by stretching your cervix open. And then you'll sit up here again waiting for a bed space to be free on the birthing centre and a midwifery to look after you, and then you're transferred down there to have your waters broken.